Welcome, all our live stream viewers. It's so good to see you all again. I'm Paula Shaw, and this is a little segment of a show I like to call Light Your Way to Health and Wellness. It's my effort to bring you some state-of-the-art, amazing information so that we can all be healthier and in a greater state of fitness and wellness. And I'm super excited about our show today because it evolved out of an experience I had myself just a couple of days ago. I went to Psy-Tek, which is a research group here in Encinitas at the Institute for Human Science. And I went to have a thermogram, or thermography, as some people call it, which I do rather than mammograms because I would rather not expose myself to any radiation that I don't need to expose myself to. And Scitec has a wonderful thermography department. But while I was there, one of the requirements for being able to have any kind of testing done there right now is that first you have a COVID test. And their COVID test was so amazing and so easy, and it's very accurate. And so I said to Bob Hertz, who runs Psy-Tek, I said, we've got to do a show and you've got to share with everybody exactly what you've got here and how they can get this test if they choose to. So Bob Hertz, please come join me so I can ask you lots of questions. Welcome, welcome.
Good to see you, Paula.
And good to see you too, Bob. So I had a great experience with you all. And by the way, Psy-Tek is not new to me. This is actually where I rent my office, and haven't been there in a while since during COVID. Most of us have had to go to telemedicine, but it was so great to go again, to see Bob, and to see so many things that have been put in place, both to keep your staff safe and to ensure the safety of the people that come there for different kinds of testing. So maybe before we get into the COVID-19 test, Bob, tell us a little bit about Psy-Tek, about your research, and the kind of testing that you make available there.
Sure. Well, Psy-Tek is really a combination of my partner, Mary Clark, who's a psychologist. She's the psych. I'm a computer scientist. I'm the tech. We got together, Psy-Tek.
Oh, I love that. In all these years, I never knew that.
We've been working together on very similar things from different directions for 2 decades now. And after opening the lab up here years ago, we decided to turn it into a nonprofit, a 501(c)(3). And so we combined Pranic Healing San Diego and some teaching that Mary does and the laboratory into one unit. We work heavily with energy medicine and complementary medicine and bridge the gap to the normal allopathic doctors and surgeons who are starting to come on board very quickly now. Appreciating what we do, at the lab, we use frontier equipment. They're not necessarily FDA approved here, but they're in heavy use around the world. They focus on looking at our energy field and allowing us to take a look at disease before and during entering the body. And we have a well-known physicist, Gaetan Chevalier, who's part of our team here, who is very well published in this regard. And if anyone's heard about earthing, Gaetan did all this research on that and helped set that company up to be successful. At the lab, we have actually 2 main ways of making money. We do research for hire. We do our own research, and then we do assessments, medical assessments. What Paula had is using our medical thermal imaging, most often for women who don't want to just use a mammogram. The thermal imaging picks up images of foreign objects within tissues about 6 years before a mammogram can. So they're very effective. And if we find something in there, then of course you go to your doctor after we give you a, actually, after Paula's scans, we send those pictures down to radiologists, MDs, who come back with a medical diagnosis that we give back to Paula, and she can give it to her physician. Anyway, we went literally out of business at the end of January, like everybody else, because all we do is medical assessments and research. Nobody wants to be a research subject while the condition we're in right now. So even though we need about 100 subjects, in hint, anybody with osteoarthritis, let us know, because we have a free COVID test and $100 for you if you want to be a subject. In the meantime,
osteoarthritis.
Correct. We have 2 different companies that have hired us for research with their products. So when you come in as a subject, very likely you're going to get relief from whatever you're working with, because that's what we're testing, whether or not different products have a positive effect on different conditions. So at the back in January, when we stopped getting any type of business flow in here, I had just purchased a robotic positioning camera. And I was using it because we were doing repetitive research on hands over and over and over again. So the robotic positioning camera was really helpful for that purpose. But when we started to see how can we get back into business, we used the robotic positioning camera to allow the patient and the technician to be 100% separated and safe. So we created a process that was approved finally by our technicians, because they're the ones we want to keep safe here. And we want people who come here to know that that's our main concern. And so we do the test in the parking lot for people who we don't know. And if they are negative, they come right in. If they're positive in any way, shape, or form, we suggest that they go back to their doctor, go to Quest, or any place to go further on testing. The antibody testing that we do is looking at the condition that we're in, not the infection. When you get a nasal swab or a blood draw, they're looking for an active infection in your body. What we do with the antibody test is we're seeing how did our body react to the disease. There are 2 antibodies that we look at. One is called IgM, which if that appears, that means you've been recently exposed. And IgG, which only comes up after several weeks of exposure and producing an immunity for that person. Now, how long the immunity lasts, we don't know yet. It's a new virus for us. And there's a lot of talk about how accurate tests are. I can tell you that the tests we use have been vetted not only by us, but by those researchers, fine researchers who are working on first responders who need to be tested every day. So the tests themselves were a surprise to my researchers, because they had many kits that had a lot of irregularities. They had false positives or negatives, and they really couldn't use them for their work. But when I sent them samples of what we found, they actually said, now we can finally do our work, thank you. And at this point, we decided to open up a research project here, because these kits are medical devices. They're by prescription. And for people who don't want to go to a doctor, who are sheltered at home, we thought it would be fair to create a research project that would show the ease of use and the reliability of these type of antibody kits. And to do that, then the reason we did it is because these are clearly marked for professional use or research only. So we enlisted an institutional review board who approved our research in April. And ever since then, we've been making these kits available on a couple of conditions. This is an official sanctioned independent research project, so we need your informed consent signature before we even get started. Once we have that, then you can pick up the kit, or we can get it delivered to you or shipped to you. And at that point, you're going to do your own test. You will find that it's relatively simple and easy. And the reason we're doing this research is to try to convince the FDA that certain manufacturers have a good reason to distribute these things for home use. And there's a lot of people who are sheltered at home who will never leave to go online to get a test.
Exactly.
They would like to know if they're immune or not, and they like to know if they were recently exposed. A note on the recently exposed. That particular antibody is comes up after you've incubated and been exposed, and everybody has a little bit different body, so the typical exposure is between 2 and 7 days. If you were to call me and say, I think I've been exposed, I would ask you to wait a day or two, then come in for the test, or let us send the test to you, or any antibody test from any other company would be fine. But the IgM is accurate for that particular day in that particular person's progression of the disease. So if they haven't incubated and they do not produce the antibodies in the first 2 days, they may do that in the next 3 or 4 days. So for IgG, which shows whether you acquired immunity or not, it's very accurate at the time. We have a 95 to 100% sensitivity and specificity to the specific COVID-19. So you're not going to get a response from having a previous virus or something like that. Now, there's several different kits out there.
And Bob, before you go into the kits, I just want to review some of what you've said for clarity, just because, our viewers, our listeners didn't share what I experienced the other day. So I want to just share that first. So first, what Bob was saying is you would arrive at Psy-Tek and then either call or text, right? And then a technician comes out to do the test when you're in the parking lot. Correct, Bob?
Correct. And we would expect that you are masked and gloved when you come.
Okay, very good. So you need to be masked and gloved. The test, and Bob's going to share it with you in a moment so you'll see it, but it's a pinprick. So it's just a drop of blood from your finger that they need. And so here's what I'm so excited about. It's just a drop of blood. You will have your results in 10 minutes. I can't tell you how many people I've talked to recently who have gone through the nightmare of not being able to get an appointment. And then if they get an appointment and go for testing, it's 5 to 10 days before they even have results. So if something's coming up in your life that you want to know for sure that you're safe to be around other people, it's very, very inconvenient to do what is being done in most places now, particularly like the free testing where you drive up. Even drive-up testing, you need an appointment. And getting an appointment is harder and harder now that we've had some spikes, particularly here in San Diego, in LA, and other places in California. So I was able, within a day, to go there. I had my results in 10 minutes. Then Bob and his staff knew they were safe doing this thermography on me. And by the way, my thermography was done with that remote camera he talked about. So my technician was in the other side of a room, definitely 6 feet away. Safer for her, safer for me. It was a total positive experience. So, okay, now Bob, so tell us about this test and how it works, and maybe show it to us if you will.
I will. I think it's only fair for me to tell you about the other tests too, because when you get a nasal swab or a blood draw and they're looking for the active infection, that is the best way to know if you are infected and where you are from the infection standpoint. The antibody test just tells you where your body is in reacting to the virus. So when you have been recently exposed, as I said before, it's hard to nail down the day. You may have to get tested a couple of times if you want to know if you were recently exposed and infected. But we always recommend doing both. If you are positive, immediately we will send you back to your own doctor to get the appropriate nasal swab and get treatment plan. We use these because most of the tests out there require extended amount of time to find out the results.
Mhm.
And the results from these, as Paula said, are within 10 minutes, very quick, especially for companies that want to screen people before they come into their facilities, like a senior residence. If you're about to admit a new client as a resident,
Mhm.
you'd like to know as soon as you can. And also to start curbing a infection within a facility, then you want to get a rapid test on everybody just to get your arms around what's going on.
Good
So
idea.
um, either way, all the tests are good. We'll only use a test that we've used for a while and our researchers say are actually successful and uh, good for our research. So um, let me show you a couple of different types of these tests. This is a pretty typical cassette, and on it is a well, and the well is to put the blood drop in and to then put the reagent on top of. And when there's another kind of test that is very similar, but up here it has the different results that you can see, so it makes it
Ah.
easier to figure out if you're positive or not. But they all have the same thing in common. There's a well to put a drop of blood in, and then some of them, like this one here, actually has two wells, one for the blood, one for the reagent. As soon as you put the reagent on top of the blood, there's like a wick in here and it starts traveling up the wick. And on the very top, there's a control bar. And we know that the kit is working well when the very top line lights up. And there's a C for control. And then typically on these kits, they will have a C, and then they'll have an IgM, and then they'll have an IgG line. So you can tell which antibody you've detected. So once again, the IgG shows acquired immunity after 2 weeks. And a note on that, we found that even if you are immune, we found that live virus can still exist in the back of your throat. We know that certain medical professionals who are working with first responders and continually exposed have shed, even though they are immune for the time being, which we
Uh-huh.
don't know how long the immunities last, but they're shedding live virus 40 days after they were first infected.
Wow.
It's important for you to quarantine for 14 days to see if you have any symptoms, but you still need to get tested even though, because even if you are infected, you could be asymptomatic and not show it at all.
And
And there's,
then someone can still get it from you, Bob?
yes. So
Oh.
um, after you're covered as far as your own disease reaction, if you have the IgG showing up, but the most people don't realize that it's not over until it's over. And we are still have to take a look at what's going on around us. We're finding new things about COVID every day that are affecting other things, internal organs and things like that. We really won't know the end result for several months, if not even a year or two. We don't expect an effective vaccine to happen very quickly, but once it
Mhm.
does, remember, when we get a flu vaccine, it's re-engineered every year. I think you
Right.
can expect that from the COVID also.
Mm.
So let me show you the process that we use. It's relatively simple. If
And
you just,
Bob, I'm wondering if I hold this up to the screen, if they might be able to see a little better what you were trying to explain about what they're looking for.
look
Can you
at the
see
bottom.
this?
Yeah, push it up just a drop so we can see the well. There you go. See where it says add sample on the bottom? That's where the drop of blood goes. And on top of that, we put the reagent, or also called a buffer. And then we wait up to 10 minutes. But immediately we'll see it start to wick up in the channel above, and you'll see it rise. And if it's a successful test, then the C will light up with a bar. And then if you're exposed and you're positive in any way, the other two lines will light up if you have either one of those antibodies. So
Great.
um,
Okay.
when these are normally packaged up when we sell them to a clinic or to a residence, they come boxed in 25s. They're not really designed for individual use. So part of the research project was to create these kits, and we repackage them so that there's one kit and one of everything. There's a lancet. There's a couple of different kinds of lancets. This one is spring-loaded.
Mm-hmm.
This one is you twist off the top and you poke yourself. So they're a little different. I prefer these, and they're very gentle. And so what we do on this one here is we pull the top off, and then after alcohol swab over here, we push this down. Now, I'm not going to actually do it to show you. It's very simple. That's it. And there comes the blood. Just a little bit. But people who've done diabetes tests or glucose tests will see that this is the same thing. It's very, very easy to do. And we have on our website at Psy-Tek, psy-tek.com, you can go to the COVID section and see a couple of videos on the tests being performed. And you'll see the different methods we have of getting the blood into the cassette. Typically, once you get a bead of blood, you'll use a pipette like this, and you'll pick up the blood, and then you'll squirt it into the cassette here. Whoops. And that's how you get the blood in. But there's also another method for people who want to take that bead and actually put it right into the well and avoid using the pipette. And that seems to be a lot easier for people who don't want to mess around with using this thing and sucking it up. And then
Is that this little guy right here?
no, but that little guy is when we get the reagent, it comes in a bottle like this.
Uh-huh.
It's good for 25 tests, but we have to repackage them so that they're usable for individuals. So we use that little centrifugal tube, and we put 3 drops in there. You really only need 2, but we put an extra drop in there, and that's part of this package with all the pieces you need to do a successful test. And the whole testing process takes about 2 minutes, and then you wait 10 minutes to see the results.
And so this is the reagent.
That's the reagent.
Okay, I'm so glad. I was trying to figure that out last night, and I couldn't see if I was seeing anything in there. That's good to know.
And when you look at the videos on how to do it, it's pretty clear.
Yes.
Also, so in the kit here, we have a lance, we have the reagent, we have the actual cassette itself in there, we have an alcohol swab, and we also have the pipettes that you would use. So it's very quick, relatively easy. We are actually going to do, they are going to do themselves here a little later. We have 5 Buddhist monks coming in who will be performing the test on themselves in about an hour or 2 before they go back up to the convent. And they feel they may have been exposed, but we'll see once they get tested.
And you know, Bob, that's one of the things I love so much about this. Share the story about your family wanting to have that gathering and what you all did.
Okay, well, we've done this not just for my family, but several families who wanted to see Grandma on her last days have come to us, and we've got a phlebotomist and a health professional to take these kids to their family and test everybody before they go in to see Grandma and we've done that several times, and it's nice to be able to serve those people. I have 12 grandchildren, and Mary and I have 7 sons, and so we like hugging a lot, and we haven't been able to do a lot of that in the last couple of months. So every time we want to get together, and we know that our own families shelter in very well and are very protective, wear the masks, and really keep to themselves for the most part. But you never know, and you don't want to be that one person who takes your whole family.
Absolutely.
So I splurge a little bit, get some more kits, get a phlebotomist over, and make sure everybody gets tested by a professional. And then if everybody's negative, we have a hug-a-thon, and for as long as we can stand it. And
I love that. That's just such a great story. But so let's get to the most important part, Bob. How can any of our listeners, because in my mind, for the small cost, to be even able to have a kit at home, just in case you want to test yourself in a hurry, or you've got something coming up and you need to know for sure that you're negative, how can people get a hold of these kits?
Okay. Well, first understand that these are medical devices and they're for professional use or research only. So in setting up this official research with our institutional review board, we made sure that all the steps necessary to protect the subjects in the research, which is you, um, are, are handled properly. So the first step is to go to the website and you'll see some instructions under the COVID. It says get tested, and you can read all about it there and get the phone number to call.
And the website is Psy-Tek.com, is it?
Yes, PSY hyphen.
And that's the spelling on Psy-Tek.
Right, TEK.com. And go to the COVID button and click on get tested. You can also take a look on what does it look like to actually perform the test. Remember, the purpose of this research is to provide, statistics and on whether or not these are truly easy to use and reliable to help encourage the FDA and other kit manufacturers to get them into the public. These are nothing more than a regular glucose test for diabetes. And it's like a pregnancy test, but you're using blood instead of urine.
Right.
So, at this point, you will get, once you talk to one of us on the phone, we will email you a document that you will sign in 3 places, which is an informed consent document that has been approved by the institutional review board. Once we have that, then we can release the kit to you. We deliver, or you pick up, or we ship it to you. If we ship it to you, it's a adult signature only. We have doctors here who are prescribing these to all of our research people so that everything is, all the I's are dotted and T's are crossed. And the next step is to take the kit and perform it on yourself. And once you're done, take a picture, send it to info@psytek.com so that we can have a picture of the results. Then we send you out another electric document which has a questionnaire on it, which are specific questions as to the ease of use that you experience and the reliability that you perceive. If you are doing it for a minor, then you do the test, and then you still have to report on the ease of use. For caretaker or parent to do somebody's just as important as you doing it yourself. So
it is safe for children.
Well, it is a blood, it's
Right.
not a blood draw, it's just a finger prick test. And that you'll have to determine based on your child and his medical history.
Okay, good to know.
All right.
So once they've done all that, so basically, you're making it easy for people to become part of your study. That takes care of all the legalities. And then you can either mail them a kit or they can come by and pick it up and do it on themselves. And then just take a picture of the little tester board that we were showing them after it's over, correct? And fill out the questionnaire.
Right. And then we end up with enough information to provide the right data to the manufacturers to either redo the kits so that they're easier to use, or to make a submission for home use. To date, the only home use ones there are now some nasal swabs. We also carry the genetic spit test that's very similar to 23andMe. However, like all the other tests, you have to wait for it to be delivered. Then you have to ship it off to the lab and wait for their response. So, and they're still very accurate and worthwhile doing. The rapid kits are just as good in my opinion, but they do not detect active infection at all. They are showing you how your body has responded and antibody production has either started or not. So I want to make sure that people understand it is a COVID test. We get a lot of people saying, oh, it's an antibody test, let's get a COVID test. Well, they're both COVID tests. One shows you what your body's doing. The other one shows you whether you have an active infection or not.
So Bob, as far as we know, like I know many people who feel like they had it early on before the shutdown, before we were all talking about it. But that would have been like some had it in December, even November. we don't know for sure, but is it possible antibodies would show up from that long ago?
Well, typically your antibodies stick around to handle the next wave and, keep your immunity going. So the question is, and we don't know this, how long does this immunity last? Do we need to have a booster shot like other vaccines that need to be refreshed? There's a lot we don't know, and we will not know for several months, if not a year or two, what the long-term effects of COVID are and what the long-term effects of the cure is. So at this point, I look at it as I look at the flu vaccine. Yes, they're going to have plenty of them. They'll come from different sources, and they will be effective based on how they were manufactured. Typical flu vaccines are only between 30 and 70% effective, from what I've read. And we're hoping that we'll get a little bit more with the more advanced methods of manufacturing vaccines, getting away from producing them in eggs, which is starting to, actually it's stopping recently producing these things in eggs because they found that that actually compromises their success rate.
Ah, well, that's good to know. Well, Bob, I am so delighted that you were able to make time to share this information with us today, because I think what you're doing is a great resource for the public, and not just for those here in San Diego, because as Bob said, this can all be handled online and on the phone, and this test can be mailed to you. So if you have interest, if you want to be sure that you're negative and not take any chances, one more time, go to Psy, P-S-Y. Is there a dash in there, Bob? Dash T-E-K, Psy-Tek.com. And there's a button there that says COVID, correct, Bob?
That's correct.
And if they press that, you'll get all the information you need to be able to get a hold of one of these tests. Oh, one thing we didn't share with them, what is the cost of the test?
Right now, we keep reducing it as the production costs go down. We're charging $45 to cover the cost of rekitting and the cost of the kit and the time that we put into it as part of the research.
Perfect. And that is a great price. I know my son paid $125 at an urgent care in LA because he wanted to be sure he was safe before we took a trip. So I think this is a wonderful price that you guys are making this very available. And again, if you're interested, go to Psy-Tek.com and then just follow the instructions, and be sure and tell them Paula Shaw sent you, because then they'll be extra nice, which they always are anyway.
Well,
so go ahead, Bob.
Well, it's always been a pleasure working with you, and all the different things we do here at the lab for assessments in health are extensively past the testing also. So when you go to the site, take a look at the other things we do. I think you may actually want to have some other types of testing down here.
Yeah, I was actually just going to say that very thing. We're channeling each other. Yeah, they're amazing people. And as I said in the beginning, I actually know this group personally. They're all wonderful, absolutely wonderful. It's my joy to work with them. So thank you, Bob. And everybody who's listening to this, please share this video, share this information with others so we can get as many people tested easily and simply as possible so that we can stop the spread of this virus.
Thank you.
All right.
Pleasure. Thanks for having me.
Mine too, Bob. Take care. And thank you all for being with us, and we'll see you again soon. In fact, I'll see you Thursday. I'll be recording my radio show, Change It Up Radio, with Marilyn King, who's a two-time Olympian pentathlete. And she's got some amazing information to share with us. So join me on Thursday. Take good care. And again, my gratitude, Bob.
Thank you.
All right. Bye-bye.